Good afternoon, my people. We are still riding on our topic, vomiting, which for the better part of the last year, end of last year, and the start of this year, we have been discussing about this topic, and I hope it's being of greater help, because I don't know whether there is anybody in this world who has never had vomiting, or what we call nausea, or the feeling of vomiting. I do appreciate the subscriptions, the likes, the comments, and the topics, the many topics you people are bringing up for us to discuss. This shows this year you are ready to learn, and you have started where we left the previous year. Let's continue discussing about vomiting, and we will start by knowing what factors should you consider before taking the over-counter medications to stop nausea and vomiting. What to consider before taking over-the-counter drugs or over-the-counter medications for nausea and vomiting. Number one, only take the recommended dosage on the product label. Remember, nobody has prescribed this drug. No doctor has prescribed you to take this drug. It's just an over-the-counter drug. That means you just buy it without any prescription. So make sure you follow the recommended dosage as per the product label. There is always a pamphlet inside each pack, or on top of the pack containing these drugs. There is always some explanations there about the dosages and all that. So follow the product's instructions on the label before you take these medications. Do not take more than one antiemetic. Do not take more than one antiemetic medication at the same time, as these may share similar ingredients. And if you overload yourself, you will be risking your kidneys. So take one antiemetic and make sure before you turn to the other, make sure it's out of your body to avoid overloading your kidneys. So do not take more than one antiemetic medication at the same time, as they may share similar ingredients. Number three, do not give bismuth subsalicylate products to children under 12 years old. Do not give bismuth subsalicylate to children under 12 years old. Number four, do not give bismuth subsalicylate product to children with flu or chickenpox, as it may increase the risk of Reyes syndrome. Number five, ask your doctor or pharmacist about potential drug interactions if you take over-the-counter medications or prescription medications such as blood thinners. So before you take the antiemetics, if you are using any other drugs, make sure you consult your doctor or your pharmacist about drug interactions or the reaction that can come as a result of the antiemetics mixing with the drugs you are already taking, because it might have some complications or adverse effects. So make sure you consult your doctor or your pharmacist for him or her to advise on the way forward. Number 6, ask a doctor or pharmacist if antiemetic medications are safe if you have certain underlying conditions. For example, heart diseases, asthma, thyroid disease. Let me repeat this. Ask your doctor or pharmacist if antiemetic medications are safe if you have certain conditions, for example, heart diseases, asthma, and thyroid diseases. A very important point to note, eat bland foods and crackers. Eat bland food and crackers. Dry crackers like soda crackers are tried and true remedy for nausea. Dry crackers like soda crackers are tried and true remedy for nausea. It's thought they help absorb stomach acids. So dry crackers like soda are thought to absorb stomach acids. For morning sickness, try eating a few crackers before getting out of your bed to help settle the stomach. For morning sickness, try eating a few crackers before getting out of bed to help settle your stomach. Other bland foods like dry toasts or white rice are also good to eat while recovering from stomach bug. Other bland foods like dry toasts and white rice are also good to eat while recovering from a stomach bug. Avoid salty, spicy, or fatty foods that could further irritate your stomach. This is very important. Avoid salty food with a lot of salt, spicy foods, food with a lot of spices, or fatty foods that could further irritate your stomach. Drink enough fluids to help prevent dehydration as you start eating bland foods. Take a lot of fluids to help you prevent dehydration as you start eating bland foods. A point to note. Try deep breathing. Take deep breath by breathing air through your nose to lungs. Abdomen expands as you breathe in. Exhale slowly through your mouth or nose and relax your belly after each breath. Repeat the same several times. It helps relieve nausea and vomiting, and also can calm anxiety that may occur as a result of your illness. Let me repeat this. Try deep breathing. Take deep breath by breathing the air through your nose to lungs. Abdomen expands as you breathe in. Exhale slowly through your mouth or nose and relax your belly after each breath. Repeat this several times as it helps relieve nausea and vomiting, and also calm anxiety that may occur as a result of your illness or your sickness. This marks the end of our first video today, and we will continue with the next video, whereby we are still winding up on this topic, and I hope many people who had questions about vomiting are getting what they were requesting. So let's meet with the next video.